I'm Heather. After many wasted years trying outdated approaches to my daughter's addiction that felt wrong to me, harmed our relationship, and didn't help my daughter, I finally found an effective, evidence-based approach that repaired my relationship with her, helped me create my own peace of mind, and made me an ally in my daughter's recovery. I teach you a loving and compassionate approach to help you encourage change and create connection. Addiction impacts the entire family system. Family recovery is the answer. Hello. I just got done recording today's episode with Dr. Evelyn Higgins from Wired for Addiction, and I'm feeling all the feelings. One is excitement that I get to share about the genetic test that Dr. Higgins created. And I would be first in line if I could do this test with Helena. I'm hopeful that this test helps change all of the stigmas about addiction and really changes people's experience. Another feeling I'm experiencing is grief that I can't get the test for Helena, which often comes up when I learn something new. I'm also feeling grateful that as I talked to Dr. Higgins, I was reminded that I did the best I could with the information that was available to me at the time. I got Helena a pharmacogenomic test. I think I'm saying that right. Could be wrong. It's a big word. That tells which medications are most likely to work for depression, anxiety, ADHD, and other psychiatric conditions. So it gives you like a red category for things you shouldn't, a green category for things that are most likely to work, and yellow, like to be cautious with. And that's instead of taking the approach to just trying things and seeing what works. But there's been times that I feel inadequate when I'm around parents that found craft right away or other supports faster than I did. Like my brain always tells me that I should have figured things out faster. But I have to override that self-judgment and reframe my thinking to acknowledge that things have changed in the last 10 years. And I have to have compassion for myself that this journey has been really hard and not turned out like I planned. And also appreciate times like this where I'm reminded how hard I did work and all the research that I did do to find a test where we could find out what medications would be most helpful for her. So my guest today, Dr. Evelyn Higgins, is the founder and CEO of Wired for Addiction. She is recognized as an international expert in the epidemiology of addiction. As a certified addictionologist, diplomat of the American College of Addictionology and Compulsive Disorders, and a diplomat of the American Board of Disability Analysts specializing in pain management, Dr. Higgins has had the honor of advising the U.S. Surgeon General, producing and hosting a Gracie Award-winning nationally syndicated health and wellness radio program, and serving as a 1996 Olympic team doctor and Olympic torch bearer. With 35 years in clinical practice, Dr. Higgins has designated over 16 years to research and development in the science of addiction recovery. A TEDx speaker, panelist at the 2022 International Society of Substance Use Professionals annual conference in Abu Dhabi, United Arab Emirates, the 2022 International Gambling Conference in Auckland, New Zealand, and a 2021 nominee for Modern Healthcare's Top 25 Innovators in Healthcare. Dr. Higgins finds herself at the nexus of epigenetics, neuroscience, and addiction. I hope you enjoy the episode. Okay, one more quick thing before the episode starts. If you ever worry about enabling, which I hear that word all the time, so many parents are worried about it, I made a guide for you. This guide will give you a new relationship with enabling. It will help you be confident in yourself and your decisions. Also, it will give you 3 science backed ways to help your child. So, the link for the guide is going to be in the show notes today. So, thank you for being on the podcast today, Dr. Higgins.
My pleasure, Heather. Thank you for having me.
Let's start with you telling us a little bit about your background and how you came up with the idea for the Wired for Addiction custom genetic test.
Sure. Like anything in life, it was not a direct path, right? 34, 35 years ago, I was practicing pain management and integrative medicine in the rural area. And I was seeing people not necessarily at that time becoming addicted, but becoming dependent on pain meds. And I was seeing a one size fits all. Everybody that comes in, here you go, you get the same thing. 20 years later, I'm practicing in an urban area and I'm seeing the same thing, but I'm seeing the rates of addiction rather than dependence really start to kick up. And it's still the same thing. Try this, try that with no rhyme or reason. That was my professional part of why I wanted to look at doing things differently. 16 years ago, I started using neurotransmitters and hormones in my practice. And then it wasn't until the tail end of 2015 that the ability to look at the genetic, what we call SNPs, or single nucleotide polymorphisms, became available. So this was 16 years of R&D to get to the point where we are today. The other reason, the other layer of my why was because I married an alcoholic, actually a man that had several addictions. And we had a child together. And a year after she was born, we found out that he was adopted. So now I needed to know, okay, what's the health history here? What do we know? And we had absolutely no information. So it was a combination of all of that. But then I got to the point of, every other area of healthcare has used technology to advance helping people. And this area, we were just stuck in as if it was 1970, 1950, doing the same thing over and over again, not getting the results. In fact, had we gotten better results, probably you and I would not even be having this conversation today, because there would be no reason for me to look into how do we do more with this? How do we advance technology into this aspect of healthcare? It's still that stigma of, hey, you got yourself here, get yourself out. If somebody has diabetes, why don't we say that to them? Why are you so weak? Just stop eating. But with addictions, we have this totally different mindset. And to me, in 2023, with what's available, we should be able to advance, and there shouldn't be a disparity in healthcare equity. And that's what we're really looking at.
Yeah. I'm really feeling that as a mom of a child that struggled with substance use disorder, and the one size fits all approach that we got, and the stigmatized belief system of a lot of people that are supposed to be helping that really don't have a better way to help. Like, that will always weigh heavy on my heart that my daughter passed away from not getting the help that she needed. So that's why when I heard about this, I was like, oh my gosh, I have to share this with everybody, because I think it's so important. And I don't know why somebody didn't do it sooner. So,
right. Yeah. It's kind of like, once it's there, it's the, wow, why did we wait till now to do it? But in fairness, we look at 85 different biomarkers. So it wasn't until that word I used was single nucleotide polymorphisms, or SNPs, that wasn't available for us to measure in the lab until 2015. Then we had COVID. We could say that we kind of halted everything else, but there's no more excuses. And I am so sorry for your loss. I can't imagine the pain that you experienced.
Thank you.
Yeah. There's things in life there's no words for, and that would be it.
Yeah, thank you. So can you tell us more about the test and how it works, what you're testing for?
Sure. So as I said, 85 different biomarkers, starting with neurotransmitters, which are brain chemicals, and hormones. So brain chemicals, things like serotonin, dopamine, epinephrine, norepinephrine, GABA-aminobutyric acid, phenylethylamine, all those good guys. And then hormones, stress hormones, sex hormones, and then these genetic polymorphisms. So it's a combination of all of that. There's not one gene. It's how all of these interact within the individual. And then how the environment plays out to turn those genes on or turn those genes off and see that behavior. And that's the whole field of epigenetics, which is, to me, the most exciting part of what's happening in science today, because this is really when, if somebody understands that and says, wait a minute, you can turn a gene on or turn a gene off. You get your genes when you're born. Here they are. Here's your cards, play them out, right? But it's our interaction with the environment and then how we respond to that, how our body responds to that, is what leads to the expression of the genes. So if somebody says, I've never seen this behavior in my daughter, my son, and all of a sudden at 20 years old, I have a different human being living in my house, right? Well, that DNA was always there. Those genes were always there. But it's whatever's gone on in the environment that has changed how those genes express themselves. And that's where we see things that are called, the science words are aberrant behavior. But all that means is things like risk-taking, impulse control, addiction, anxiety, depression. That's all the error in the coding acting out and expressing itself in a different way. And that's why we look at that whole package.
So genetic polymorphism, what does that word mean?
So it means simply it's an error in the coding, right? So, and there's a gene comes in a pair. So there's two in there, and it can be like, don't want to use so many science words that your listeners say, oh my gosh, but you can understand this. It just is a different language. So there's a pair. If one in the pair is affected, that's called a heterozygous result. If both in the pair are affected, that's called a homozygous result. So we can look at all of this and see, okay, is there one of the pair affected, both of the pair affected, in what area? And what is that going to do to the rest of the body? And how is it going to affect the outcome?
Okay. And so you're not saying that there's an addiction gene, but just that there's possible epigenetic modifications in any of our genes.
Correct.
Okay.
So let's say like one of the genes that we look at is the GAD1 gene. So glutamic acid decarboxylase, right? So it's an enzyme that's responsible for the conversion of glutamic acid, which is a stimulant to our nervous system, to GABA, which is a calming to our nervous system. And if we have a deficiency or a polymorphism in this enzyme, we get things like the half glass empty syndrome. So somebody that's always saying, somebody else says, oh my gosh, what a day, it was fabulous. That person will say, yeah, but that thing happened. And that's all that they can see. So if somebody's got this, are they going to be reaching outside of themselves to find pleasure from somewhere else? Probably so, right? Or a COMT gene, which catecholamine methyltransferase, this makes for prolonged anxiety or prolonged depression in an individual. They just can't kick it. Where somebody's hanging out with their buddy and they're like, get over it. And that person just can't get over it. So we measure those things and then we look at the biochemical pathways and say, okay, where do we need to support, instead of what we started the conversation with? One size fits all. Here you go.
Yeah.
We've got 7.5 billion people in the world with 7.5 billion different DNAs, and yet we do the same thing for everybody. That would be the definition of insanity.
Right. Yeah. There's nothing else that there's that like kind of factory processing, right? Like I had breast cancer. I had my own unique treatment, right? And which was also included a look at my genetics quite extensively. I had a genetic counselor. Everything else, I had this full picture help. That's why as soon as I heard about this, I was like, oh my gosh, that makes sense. Because back in 2015, I got my daughter tested for the MTHFR gene mutation, but that was the only thing I could get her tested for at the time. So, what causes these modifications or their changes in their genetic expression?
Okay, so like I said, you're born with your DNA, here it is. But then when you are interacting with the environment, are there stressors? Are there things that have happened in this individual's life that then that's going to modify the expression of where we end up? That's when I use the example of a parent says, I've never seen this behavior in my child. They turn 20 or whatever age, and boom, or they turned 12 or 15, hormones kicked in. How did those hormones affect everything else that was going on within that individual? So it's how we're interacting with everything around us in our environment.
That's so interesting you say that because that was what I noticed with my daughter, like a big change when the hormones kicked in. And she actually was born dead, lack of oxygen, because I had my placenta ruptured. So I'd read that there's not a lot of study on it, but that possibly there can be some emotional problems with those kids when they're fine up until their hormones kick in. So it's interesting that that was one of the things that you mentioned. So this is just, I think, could be so valuable in any
Absolutely.
situation.
Absolutely.
So so when you notice these changes in gene expression after somebody gets this test, then what do you do with that information? Can there be changes or repairs?
Great question. Sure. And that's the exciting part of all this. They can change, they can repair. And that's when we look at the biochemical pathways. We get the results of someone's lab test back. We're looking at all of 85 of these biomarkers. And then what do we need to do to support each one of these particular biomarkers? And then understanding now, having a better picture of how that person thinks, so how they interact out in the world. Then you can look at the lifestyle parts of that person. Maybe with the person that always sees the glass half empty, it would be working on those ants, those autonomic negative thoughts, right? Every time you have one of those. And if we all stop and think, even if that's not an issue for us, we stop and think, how many times a day does that come into your mind? An automatic, just a boom, natural, because you were programmed from something that's gone on that way, or the negative self-talk or those kind of things. But there's so many. There's teaching someone to meditate, all of those parts that slow down our brains to where we start to understand ourselves. And those are all the really very simplistic parts, the lifestyle parts. The hard parts are the physiology, looking at all of these biomarkers. Then also we do another lab test called the pharmacogenomic lab test, which takes that individual's DNA and says what would be the best pharmaceuticals for them, the safest, most cautionary. We see a lot of patients with adverse effects that started their downhill decline from another medication. And oftentimes we see that's on the list of that individual should never take. So there's so many advancements here, Heather. And that's the thing, to get people to understand that there really is. And a lot of physicians aren't even aware because it's not in their toolbox. So as the consumer, to be armed with that information is really, really, really powerful. In fact, in my TED talk, I frame it around, what if in your youth you knew what your DNA was made up of, you knew what your physiology was, would you play out your life differently? Right? We all have free will, but if you knew that, would you make different choices? And that's the power in this. And I'm hoping people can start to understand all of our families, we come with something. It might be cardiac disease, cancers, mental health, addiction, whatever the case may be. But if you know that, you can then choose to make whatever choices. We still have free will, but what choices are you going to make armed with that information?
Yeah. And what choices would we make as parents to educate ourselves earlier to start supporting our kids before they're having a problem? Because we'll know the possibility of what problems are going to come up. So instead of, like, for me, when my daughter was really struggling with substance use disorder, I'm behind on this process now, and her addiction is changing faster than I can learn. And so just having that advantage of knowing ahead of time of just lifestyle changes that you could start with.
Exactly.
And that test that you mentioned, I can't remember what you said that it was called, but the one that tells what medications are best for you.
Pharmacogenomic.
Okay. Yeah. We did that as well. And we got this printout saying like, these are like green light categories. She should never take these. And these are the most likely to be helpful. And then there was the red light ones that she should not try. And then kind of the yellow, like, be cautious. And I had to ask so many doctors, and a lot of like even psychiatrists were like, well, we'll just trial and error. And I'm like, well, why does she have to suffer for months or even years while you try to figure out what works? And when there's this genetic test she can take.
Right.
It makes so much of a difference. And I can't, like, knowing when somebody wants to feel better, of course, they're going to turn to a substance if it's going to take 6 months or a year or longer to figure out what works for them.
Absolutely. So often we find it's either a diagnosed condition, an undiagnosed condition, or a trauma, or all of them. It could be diagnosed, but not being treated correctly. If you're not getting the right meds or whatever support that it is that individual needs, they are going to go outside of themselves to try to self-medicate. And the first thing that comes along, that's that, oh, that feels good. I mean, every day we talk to people that say, I started, say, drinking when I was 8 years old. 8 years old. I was on the beach with my dad. He was surfing and he said, hold this. I remember that first sip and it was a wow. And this gentleman has a history of trauma and abuse and everything that would make sense to say, I now feel anesthetized. Am I going to go back? I don't feel anymore. I love it. I don't feel. I'm going to go back and try that again. Even if there aren't problems in an individual, especially teenagers, when I talk to them after they get their results, I'm like, so here's the deal. After school, kids are going to say, hey, we got a great idea. We're going to go try this. And you're one of the group. You go ahead and try it. You can't do it because the next day you're going to want to do that same thing. When your buddies say, no, we're cool, we're going to do something else today, you're like, no, I really want to do this because it feels good. You don't get that chance.
Yeah. So that first time is different for every single person.
Yep.
Yeah.
And when anyone shares that first time, they're always, you can feel it with them when they're sharing what that first time was like, because it hit every one of these things that we're talking about. And it worked until it didn't work.
Right. Yeah. That's so powerful to know. So going back to aberrant behaviors, can we talk a little bit about what those are, a little more about those, and like how environment can impact them?
Sure. So things like, the examples I use for aberrant behavior, risk taking, impulse control. We always see these things with addiction itself, anxiety, depression. So often, almost all of the time, there's a co-occurring disorder in that individual that isn't being treated to help them. And that person is going to reach out. Okay, what can I do? What makes me feel better in that moment? And that's the part where when we identify these biomarkers, we already pretty much have a really good idea of what that person is either already doing or is going to do. So we cut all that off at the pass and they understand that and then start to employ other things in your life rather than going with your buddies who want to go get high. Well, this is going to make you feel good and it's this behavior. So to me, when someone understands the theory of all of it, that's how my mind operates anyway. I don't have to understand everything, but if I can understand the theory, then I can figure it out. And then I'm still making my choice at the end of it, but I can make a really educated choice if I understand the theory behind something.
Yeah. So could anybody develop aberrant behaviors under the right conditions? Like that's possible for any of us, any person?
If you have these particular biomarkers, sure. If you don't, that may not be your go-to. It may be something else that makes you get that feeling that you're after.
Yeah. Well, I can only imagine how it would feel if I was struggling and then I got this genetic test that just kind of said, like, this is just what was inevitable for you with your life circumstances, right? Like, then it no longer, there's the question of morality or weakness, or that's just all gone. I can't even imagine how good that would feel.
Bingo. So often, Heather, people start crying in a good way,
Yeah.
tears of like, oh my gosh, you get it now. You understand me. And it gets rid of the stigma, the morality. It's not a moral flaw, it's a disease, and all of a sudden it's like, whoa, you understand yourself, your family, the people in your life understand. And now there's a game plan, there's a blueprint. But that kind of feeling of, wow, a lot of times people are in tears. And I get it.
Yeah. So, how do you see this changing stigma about addiction in the future of how we treat addiction or even think about it?
Because now it's identifiable. So before, as it's people, I thought, why is it with an addiction? Somebody said, yeah, I don't think that's the way to do it. If someone needs a heart transplant, do we say, yeah, I don't think that's the way to do it? Why is it okay within this field of health that we're still allowed to think this way? It's beyond reason, right? So we identify, and that's what we do with Wired for Addiction. We identify, we isolate, and we measure. So it's objective information. We work a lot within the legal system too. And when judges get this report, they're actually really happy because they can make a decision based on biomarkers, data points, objective information, rather than somebody's subjective report of 15-year-old came into my office, unkept, this, that, and the other thing, bad attitude. That's all subjective. That's your interpretation of that individual. We have data points, and that judge is like, I can make a decision based on objective information. Makes their job easier.
Oh, yeah. It takes the the judgment out of it.
Exactly. And then it makes everything become treatment centric instead of punishment centric for that individual. And then, regardless of what somebody's belief system is politically or anything else, all of society loses at the end. If somebody comes out from a time that they've been jailed, if they didn't have mental problems when they went in, they certainly would when they leave. And then they're back in society. All of society's in trouble. It just makes so much sense.
Yeah. Yeah, it does. I mean, jail definitely is not treatment. It does it does not help with whatever made somebody want to use in the first place. That's why people are so likely to overdose right after they get out of prison.
Exactly. Exactly.
So, how can somebody combine this test along with working with a counselor or treatment or something else?
Perfect. And that's exactly the way to do it. If you're working with a counselor, a coach like yourself, a treatment center, you find yourself within the legal system, we work with all of those different people, be it a counselor, whomever. Reach out to us, tell us you're interested. We'll say, perfect. Here's how we do it. We drop ship the lab kits to the patient, even if using the jail example again, even if they're incarcerated, we drop ship the lab samples, do it. And then we want you to continue working with your counselor, your therapist, your coach, whomever, because there still has to be that psychosocial. So, right, we know addiction is a biopsychosocial disease, only we haven't been looking at the bio part. We've been looking at the psychosocial and putting it on the individual, whereas we have to have that behavior modification. We have to have that talk it through, but we have to identify where physiologically we have problems.
Yeah, and that would make it easier even to focus on like what their therapist works on with them, right?
Totally.
The target.
Right. Just a couple of genes that I talked about, you say, wow, okay, so they can't bounce back from anxiety and depression. This makes so much sense about what we talk about every week. Okay, let's focus in there and say, this is actually what's going on in your physiology. So what would be ways that we can turn this off? Obviously, you're doing your protocol that was created as a result of the biomarker. But if we need to lessen that anxiety and depression, let's really focus on what makes you bring it down and calm your mind. What is that for that individual?
Yeah, and then added the right medication. Say if they were taking an SSRI, but they needed an NDRI instead, like
I can't tell you the amount of times the patient will come to us and they've been on an SSRI for 15, 20 years, which first off, those drugs were never meant for an individual to be on for that long. They were meant to work in acute situations, not chronic, 15, 20 years. And their serotonin is in the tank. So it's like, first off, that was never doing any good for you. And there's a side effect to everything. So your kidneys, your liver, your bladder, everything had to process this to no avail. Because from the beginning, you were not treated the way you were supposed to be. And what happens to an individual emotionally and mentally if you've done well, let's try it to this SSRI, let's half it, let's double it, let's do this, let's do that. You start to think it's you and you don't want to be better. And you start to own that. And that's not the case. It hasn't been identified of what's going on with you from a physiological aspect.
Yeah. And then as a loved one, even having that understanding would make you able to be so much more compassionate and know how to support them and not constantly questioning, are they serious about recovery? Do they want it enough? It's like, no, they haven't been getting the help that they need. So many questions answered. I love this. So is it a cheek swab? How is the test done?
Sure. It's a cheek. There's the neurotransmitter portion of things. Saliva, urine, because we're looking at not what's circulating, but what's bioavailable and breaking down. So your body, we know, can use these. And then the SNP portion of it is a cheek swab. And all that information together gives us our 85 biomarkers.
So if somebody wants to get this test for themselves that's listening or their loved one, how do they go about that?
Sure. So our website is Wired for Addiction, all spelled out, wiredforaddiction.com. Go on there. We even offer a 15-minute complimentary consultation with one of our clinicians to see if this is something for you, because everybody's got a different story of what gets them to that place of addiction. So share your story. What have you done so far? And then we can go from there. Like I said, we work with people from all over the world. So we drop ship the lab kits, as I said earlier, even to a prison. So wherever that person is, that's where we start with them. And we work with someone over a 6-month period of time. So we create that report, that protocol, and then we stay with them during that period of time to make sure everything that we're expecting to see is happening.
So there's two parts to it. There's the test, and then you guys follow up and make sure that they're getting the support and help that they need.
And then even sharing that information with the therapist, with the clinician, with the coach is, as you said, helps that clinician say, wow, okay, here's what we really need to focus on and here's why. And there's such a bigger understanding then.
Yeah. Yeah. Well, thank you so much for just even your having this in your heart to do it and then following through on doing it. I am so grateful to get to share this with the audience because I think that it just takes out all the guesswork. And I think we really needed something to come into like what our capabilities are today to be able to support somebody who's struggling with substance use disorder, because we're so far behind in that. And I think that this can really, like, I would be there in a second having my daughter do this if I could. So I really thank you for doing this work and all of the people that you're going to help with it.
Thank you, Heather, and thank you for the work that you do. It's so important.
Thank you. Thank you for listening to this episode. If you want to learn more about my work, go to heatherrosscoaching.com. If you want to help other parents who are struggling with a child's addiction, you can do it 2 different ways. First, you can share the podcast with them directly, or you can share it on your social media. Second, you can leave a review. Talk to you next week.